Welcome to the Liverpool Women's Hospital VR suite. In this immersive experience, you are in control. Feel free to look around and explore the spaces. If possible, use the supplied cardboard viewer and view in the highest resolution possible. You are approaching the main reception area. To your right and left, you will notice the self-service screens. You will need to head here to check in when you arrive at the site. To the far left is the main corridor. You will be sent here after checking in, and it's from here you will find the main areas of the hospital. Welcome to the Hewitt Fertility Centre, Liverpool. When you reach us, you may already have been on a long and difficult fertility journey and may be anxious about what lies ahead. We hope this video provides you with reassurance that we will look after you before, during and after your time with us, and alleviates any worries you may have on how to find your way around our department. For those of you who have already used the Hewitt Fertility Centre in the past, we hope this video provides more information into the work that we do. As you enter the Hewitt Centre, you will be greeted by our reception team at the reception desk on the right. Our friendly staff will ask you to confirm your name, date of birth and your address. You may be asked to update your details if they are different from those on our system. Your first appointment will be a consultation with one of our nurses or doctors in one of our consultation rooms. At this appointment, you will discuss the results of any previous tests you may have had, any further tests required, and your treatment plan. You will also complete some consent forms for your treatment. At various times during your treatment, you may need an ultrasound scan in one of our scan rooms. Scans are done before starting treatment to look at your ovaries and womb lining and to check for any potential issues that may need to be dealt with before starting treatment. You will also have scans throughout your treatment to look at your ovaries as your follicles grow and as your womb develops before your egg collection and embryo transfer. You may also have a pregnancy scan if you have a positive pregnancy test to check that all is well. You may need to provide 1 or 2 blood samples to help us find the best treatment plan for you and to test for certain viruses before your treatment starts. Blood is taken in one of our dedicated treatment rooms by one of our healthcare assistants or fertility nurses. On the day of the egg collection, partners may be asked to produce a sperm sample for the treatment. A labelled sample pot and a production form will be provided and you will be shown to the production room. The room is soundproofed and has visual aids to try to make sperm sample production easier if you wish to use them. Once you have produced your sample, a nurse will take your form and sperm sample pot from you. You will need to confirm your identity when you hand your sample over. Please be reassured that our team will make sure your privacy is maintained at all times. If you have any difficulties producing your sample, please talk to our nursing staff when returning to your private room in recovery. This is our recovery area where you will be given one of our 6 private ensuite rooms for your comfort. Here you will be looked after before and after your egg collection and embryo transfer by our dedicated nursing team. When you are ready for your egg collection, you will be brought through from your recovery room into one of our procedure rooms. Your partner can accompany you into the procedure room for identity checks, but will need to return to recovery during the procedure. Here you will meet with the embryologist and clinical staff performing your procedure. An anaesthetist and their assistant will also be present during your egg collection and will provide your sedation. Once the egg collection is over, you will be transported back to your recovery room in a wheelchair. The procedure room is where we also perform your embryo transfer. Your partner can accompany and stay with you for the embryo transfer procedure. We try to make the procedure as relaxed and calming as possible, and you can see your embryo on a TV screen before it is transferred if you wish. Through the other side of the procedure room is the embryology laboratory. The laboratory has specialised equipment to help us provide the best possible environment for your eggs, sperm and embryos. If you have sperm, eggs or embryos frozen, we store them in a room known as the cryostore. Your sperm, eggs and embryos are carefully stored in tanks of liquid nitrogen at -196 degrees Celsius. We have a fantastic team of fertility counsellors who are here to support you at any time before, during or after your treatment. You don't have to go through this fertility journey alone. All of us at the Hewitt Fertility Centre wish you the very best of luck for your fertility treatment.